Hi, I'm Summer Hawkins based at Boston College in the School of Social Work, and I'll be sharing our recent work on the impact of school shootings on adolescent school safety that was published recently in the American Journal of Public Health. I want to first thank my colleagues, J.C. Hodges, Danielle Walker, and Christopher Kit Baum. In 2020, firearm-related deaths were the leading cause of mortality for children and adolescents, with more than 3,500 youths dying by gun violence. We've also seen an increase in school shootings, peaking in 2018 and 2019, with 75 shootings occurring each year. Recently, almost 1/3 of states have weakened their gun laws, which has important implications for adolescent health. Dr. Marco Gianni and colleagues recently found that states which adopted stricter gun laws decreased the likelihood of adolescents avoiding school due to safety concerns and carrying or being threatened by weapons at school. Stepping back, whether exposure to school shootings themselves are associated with these behaviors remains unknown. Therefore, we examine the impact of school shootings on 3 indicators of adolescent school safety. We use repeated cross-sectional data from the 2009 to 2019 Youth Risk Behavior Survey biennial school district surveys, which collect self-reported health-related behaviors on 9th through 12th grade students in public and private schools. Our analytic sample included 211,236 students aged 14 to 18 years from 24 districts that collected information on 3 dichotomous outcomes. First, the number of days not attending school due to feeling unsafe at school or on the way to or from school during the past month. Second, the number of days carrying a weapon on school property during the past month. Third, the number of times being threatened or injured with a weapon on school property during the past year. Here is a map showing the distribution of the 24 districts included in the YRBS school district survey that were included in our analyses over the study period from 2009 through 2019. We also obtained school shootings data from the Center for Homeland Defense and Security from April 2009 through March 2019. We defined a school shooting as resulting in an injury or death that occurred at any high school in the district. Shootings were linked to each adolescent based on whether the event occurred between April 1 of the previous survey year to March 31st of this current survey year, as the YRBS is administered biennially in the spring. School shootings were dichotomized, one or more for each survey period. For our statistical analysis, we first examined the associations between adolescent demographic characteristics of age, gender, and race ethnicity, and each outcome using adjusted logistic regression models with year and district fixed effects. We then conducted 2-way fixed effects logistic regression models to assess the impact of school shootings on each indicator of school safety, controlling for demographics with year and district fixed effects. We tested interactions between school shootings and age, gender, and race ethnicity using Wald tests. Only one interaction was jointly significant, but none of the stratum-specific estimates were significant, so those results will not be shown. We conducted 2 sensitivity analyses expanding our definition of school shootings. First, examining the associations with school shootings that occurred at any elementary, middle, or high school in the district. And second, examining the associations with shootings that occurred at any school in the state. We also conducted 2 robustness checks with the main model. We first included county-level indicators of % Black, % Hispanic, and ratio of 90th to 10th percentile of income based on data from the American Community Survey. None of the factors had any effect. Second, we include an indicator of any school shooting in the prior 2 to 4 years, meaning in the prior wave, but it did not alter the effect size nor significance of exposure to recent shootings. Analyses were conducted using Stata with robust standard errors and survey weights to account for the cluster sampling design. First, moving on to the results, the descriptives. Over the study period, 17 of 24 school districts experienced at least one shooting with a total of 56 shootings across districts. Overall, 9.2% of adolescents reported avoiding school because of feeling unsafe, 3.5% reported carrying a weapon at school, and 7.3% reported being threatened with a weapon at school. We found that age was positively associated with each outcome. Males were less likely to avoid school because of feeling unsafe than females, but more likely to have weapon exposure. And Black and Hispanic adolescents were more likely to report all outcomes than white adolescents. Now results from our fixed effects models. We found that being exposed to high school shootings was associated with adolescents having 20% greater odds of avoiding school because of feeling unsafe than those who had not. We found some evidence that high school shootings were associated with an elevated risk of carrying a weapon at school, but at the P equals 0.08 level, while there were no effects of shootings on being threatened with a weapon at school. In sensitivity analyses, the findings were consistent, but slightly attenuated for the outcome avoiding school. We found that adolescents being exposed to school shootings in any any school in the district, or at any school in the state, was associated with an increased likelihood of avoiding school because of feeling unsafe than those who had not. The alternative specifications were not significant for either of the other two outcomes. There were several limitations with our analyses. First, the YRBS is based on self-report and subject to reporting bias. Because our analyses included only 24 school districts, the findings may not be generalizable to all high school students. The YRBS also does not release school identifiers, so it was not possible to isolate the effects of attending the actual school where a shooting occurred, or whether adolescents moved into the district after the shooting took place. And finally, the YRBS was administered in school, and students who avoided school because of feeling unsafe may be underrepresented in the data set if they were absent on the day of the survey. This suggests that our findings may underestimate the true association between experiencing a shooting firsthand and adolescent concerns about school safety. Moving on to the discussion. Our results extend previous work by demonstrating that simply being exposed to school shootings increases adolescent school avoidance because of feeling unsafe and possibly increases weapon carrying at school. Our work highlights that the negative ramifications of school shootings extend far beyond the event itself. These effects are evident for exposure to shootings that occur not only in high schools within the district, but in any type of school in the district or state. Due to ever-expanding news coverage and social media, exposure to such events beyond school districts will likely increase. In response to rising firearm violence, healthcare providers need to screen for the educational and psychosocial sequelae of these events. Our findings underscore the need for continued advocacy to implement policies that reduce school shootings and gun-related violence, as they have previously been found to reduce adverse outcomes. Minimizing the number of adolescents impacted by these horrific events remains a public health imperative. Thank you.